Hello and welcome to another episode of The Untold, the show all about great people, the untold stories behind them, their experiences, and their journeys. I'm Abdullah Al-Hindiani and I'm joined by my colleague.
Marzouk Said, and today we have a special guest. His name is Dr. Ali Sarraf. He's specialized in hand injuries. I know a lot of people, when they think about injuries, only like physical,
Yeah.
but he's really about hand injuries. So if you're like into sport, handball, volleyball, or maybe like building muscles,
Yeah.
then this episode is gonna be very important for you.
Yeah, and I'm actually very curious and interested to see him and interview him because personally, as someone who has been into a lot of sports growing up and still now, I do have a lot of injuries. A lot of them have, unknown origins and stuff. So I'm really curious to talk to him and see all about it.
Definitely don't miss this episode and stay tuned to watch it till the end. Hello again, our dear viewers. We're still continuing our interesting segments with interesting guest, Dr. Ali Shaban, specialist in hand injuries.
Yes.
And
Pain, musculoskeletal pain.
welcome to the show, doctor.
Thank you so much.
Seems like you come fresh from the clinic to the
Yeah,
show.
correct. Immediately. That's the last day of work, or at the end of the day, so I had to.
I mean,
It's
we're
good
kind of lucky to have you doctors on the show because I know you have such hectic and busy schedules.
Yes.
Yeah, so
yes.
first we'd like to thank you though.
Oh, thank you so much. In fact, thank you for this opportunity.
Sure.
It's such a great opportunity.
This
I think
episode
people
is
will.
very important. If you are
Yeah.
like a player, you are like having like maybe like in gym, working out,
Mm-hmm.
any injuries that regarding hand, regarding like muscle tone, then our doctor Ali Shaban will be here to
Hopefully,
answer.
I can help. Yes, I hope I can help.
Definitely, inshallah.
Yes,
So
inshallah.
what inspired you? Take us like back in the days.
Yes. Okay. So we're talking about way back in 1999, actually.
1999.
Yes.
Interesting.
That's when I first got into the field of allied health, and I was looking at the different specialties at the time, what I can do basically. So my major, original major, that's occupational therapy, is very highly tied to pediatrics. And I did not want to do that. I said that's the only thing that, even though it's occupational therapy is known for its pediatric treatment, correct? I said I don't want that.
You didn't find yourself in it.
No. I couldn't, no matter what. I tried. They even put me in a clinical setting, a pediatric clinical setting, for about a month, and then I actually requested a change because of that, because I couldn't handle it.
Yeah.
Let's say it was mostly pertaining to emotionality. I see the
okay.
child, my heart breaks.
Yeah.
I couldn't continue.
Especially with their cute look and
Yes, absolutely. So I couldn't continue with that. So I was looking at the different specialties, and hand therapy came up. I was intrigued. What is hand therapy? What do they do? So I took in 2003. I took on a full 6 months placement in hand therapy.
Yeah.
That was in in Madison, Wisconsin, a very small
In the
town
States.
in the States, correct. And I fell in love with it the first week. And 3 months in, I was totally hooked in. That's
Wow.
it. Yes. I
so we
was
could
hooked
say
on.
like a love from first sight.
Absolutely. Especially with my supervisor who supervised me during that 6 months of fieldwork placement. She encouraged me in the end. Like towards the end of the placement, she actually said that I had one of the, let's say, more higher skills than
Inshallah.
compared to other students that she saw in the past. And she saw that my splinting skills, which is something very specific for hand therapy, was pretty high for someone who just came out of
Mashallah.
Yeah.
college, fresh out of
But what about hand surgery and hand injuries in particular
Yeah.
that made it feel special to you and made it feel different? Like, what was that key thing?
It was the atmosphere, I guess. The hustle bustle. It was quick. It was fast. You had to be busy. You're busy the entire time, especially when we had clinic days. That's when the surgeon goes over either new clients, and he decides what type of surgery he's gonna do, or if they require surgery at all.
Yeah.
And then compared to no patients who had already done the surgery, now they need therapy and they need to be taken care of. So it's pretty hectic because we can easily see between 30 and 50 to 50 patients in those clinic days alone. So I think I fell in love with that. That's just how the interaction of it. I'm just following my surgeon around,
Yeah.
from client to client, from patient to patient, giving recommendations to the patients and doing exactly what the surgeon
It's
wants
kind of
me
like
to
keep
do.
you busy and involved during the whole time.
Yeah.
And what else like make it more special and different than the other medicine?
The other
field?
it was pertaining to to the hands. It's hand therapy. In Kuwait, there's hardly anybody with my specialty.
It's actually the first time I heard about it.
Yes.
Yeah.
So I do have the highest level of degree and
Mashallah.
highest level of experience in
Mashallah.
Kuwait. Yes,
Mashallah.
thank you.
Yeah.
But there are some other therapists now in Kuwait that I was able to teach, and they're
Guide and
yes,
mentor.
and they're slowly now building on the field of hand therapy in the government sector and Ministry
I
of Health.
feel really proud as a Kuwaiti to know
Thank
such
you so much. Yes,
experience
it's-
and
It's
someone who's
amazing
high quality
for
in
me.
this field.
Yes.
Yeah.
And speaking of hand injuries in particular,
Yeah.
because personally I know of carpal tunneling.
Yes.
Yeah, and I know about tennis elbow
Correct.
because I had
Those two are the most
yeah,
common, most famous
yeah.
injuries.
I only know about them because I've had both of those.
Oh, okay.
Yeah. So I want to ask you about common hand injuries.
Yes.
I know we've mentioned two,
Yes.
but what are the other ones?
Okay. The most common hand injury if a traumatic injury or an accident is not involved.
Yeah.
If we remove factors that might involve you in some sort of accident, whether it's a motor vehicle accident,
Yeah.
it's a work accident, it's a sports accident. If we remove the accidental variable, most common injury is inflammation.
Inflammation.
Yes,
Due
which is
to-
التهاب بالعربي.
Yes.
Iltihab, yeah.
Yes.
It's usually due to
Overuse, constant pounding on the muscles. They're using their muscles without giving them
Extensive-
some sort of break. They're using their muscles in a very repetitive motion without giving themselves a break.
I think that's kind of common like when it comes to bodybuilding.
Oh,
For those who
absolutely. Not
doesn't
just-
like recover and they
It's not just
usually-
bodybuilding. A lot of desk jobs also end up, with people with desk jobs end up getting inflammation due to the fact that they're stationary
yes.
on their desk.
Yeah.
They don't move their bodies that much, and they're just sitting there working for 7 to 8 hours a day, just sitting down and working with their hand.
Sometimes your elbow becomes like not in the right degree.
Correct. And then the elbow is not supported, so it adds to so many variables. In the end, the muscles become stiff, hard. They start causing pain in the neck, low back, shoulder. The person working on the computer starts feeling carpal tunnel, other inflammations in the shoulder, stuff like that. Tennis elbow is considered an inflammation.
Oh.
But new research, finally, there's new research that came out, and we know that tennis elbow is a complex injury now.
Yeah, because I remember the healing process took like 8 months. or
Yes,
something. It was
yes.
so long.
Yes, it takes. The healing process can vary from one person to the next, and depending on the severity of the injury itself, but it can range anywhere between a month to a year.
Yeah, it took a long time.
Yeah.
And the pain was, speaking of this one in particular, it was so confusing to me because you don't feel anything. But then as soon as you lift lightest thing, it's like there are some twitches.
Yes, that's tennis elbow for you, as well as carpal tunnel.
Yeah.
There's these two specific disorders. They're one and the same in that they're sort of masked. They don't bother you that much
Yeah.
until they're there, until like you feel it, and once you start feeling it, it becomes so bothersome, so painful, that it's like you just want to change hands.
Yeah.
Like, can I just remove this hand and then
Oh my God.
put on a new one?
Yeah.
That's how hard it gets.
Yeah.
Talking about like treatments, is there like some seasons where getting fast treatment could really help?
Oh, absolutely. This is not just pertaining to inflammations, it's also pertaining to any fracture injury or a traumatic injury that's resulting from an accident. If you don't get, the quicker you get to it, the easier it becomes to clear. One way of explaining it is, if you have a desk and you just keep piling papers on it, just keep piling without arranging them in any way or form, let's say after 2 years, you come to that desk, it's going to be a mess.
It's a mess.
Definitely.
Yes, it's
I love that metaphor.
Yeah, it's going to be a total mess.
Yeah,
exactly.
Now, try to fix it in one night, or arrange that desk in one night. Can you? You, in reality, no, because it's going to take you a lot of effort to clear that desk and basically make it organized. It's the same thing with the injury. If you leave that injury for so long that it start taking root into the body gets used to it. When I want to clear it, I cannot clear it in one session. I cannot give you treatment in just one session. That's not gonna happen. Okay? I need you to come back several times in order for me to clear the entire injury.
Yeah.
With tennis elbow, for example, I've had a patient who had a tennis elbow for 3 years.
MashaAllah.
Yeah, and it took him 6 weeks to at least get over that. Like he said, I'm 90% now better.
Yeah.
And it took 6 weeks. It wasn't easy. Compared to somebody who got tennis elbow 2 months ago, and he came in, and that only took like 3 to 4 weeks, and he was 90% better.
The quicker you come, the easier it become. And
Correct.
how to check like for the injuries? I know like for some like diseases, you go like to do blood tests. But how can you check the status of your hand if they are correct?
Pain. Yes, the mind is a wondrous thing. If you start doing too much activity to the point where your muscles are no longer let's say keeping up, and they're starting to get tired, your brain will recognize that and will start sending signals. They will lock up several of the muscles, and then you will start to feel pain either in this joint, or shoulder.
Yeah.
And you feel it, like you feel your muscles getting tired quicker. You feel the pain easier, and you'll say, "What's that? Like, what's going on exactly?" That's the body trying to talk to you. That's your body trying to talk to you.
That's
Listen
the time
to it.
when you should go and consult with Dr. Ali Shaban.
Yes. So if the pain is there, persistent, and it's more than a medium to high pain, and it's there for 2-3 days, a week now, that's it. Listen to it. Go get yourself checked up.
Yeah.
Yeah.
And I think we're going to highlight that more, but we have to take a quick break,
Sure,
and we'll come right back. And we're back with Dr. Ali Shaban al-Sarraf, and I'm going to ask you a question about working with people.
Yes.
Because I know you've probably worked with young people, old people.
Correct. Yes.
Yeah. How is the treatment different from those groups, and the injuries themselves? How are they different between those two groups?
Yes. Okay. So, in young people, the injuries are not cumulative. So they're not the result of years of practicing or using their bodies, and now that organ or that system failed, and they need help. It's most likely due to a traumatic accident, and they need surgery. So an accident happened either in sports or motor vehicle accident or at work, and then that basically, let's say that part, either the elbow, wrist, or shoulder failed, and injury happened, and they in the end they needed surgery, and then after the surgery, of course, they come to me for post-surgery rehab. Compared to older individuals, most of their injuries or I'd say their problems come due to the fact of years of abusing their body. Exploiting the body, beating that body down with activities, work, sports, gym, stress. Stress adds a lot of physical muscular pain without us knowing, believe it or not. And it usually manifests in either some sort of inflammation or some sort of disorder afterwards.
And also, I think the healing process takes longer.
Takes longer, of course, due to the age factor.
Yeah, because I remember I used to play football a lot.
Yes.
And then all of my injuries, I think within a week or two, they would be gone.
Be gone, right?
Yeah. But now I have an injury from years ago in my hand, and it's still here.
Oh my God.
Yeah, from also playing football.
Oh my God.
That's just the healing process.
Well, that's the thing.
It just slows down.
Absolutely.
Yeah.
I know.
Because of age, as we age, our systems start slowing down. Our recovery systems start all of it. Everything starts to go down and slow down. So recovery absolutely takes time, especially if in older age you also, for example, get become diabetic, or have high blood pressure and stuff like that. Those factors even add more to the period of recovery.
Talking about like the recovery and the cases, I know like there are some diverse. Some could be like easy, some could be very extreme.
Yes.
Was there a case that you find challenging?
Yes, I did. It was a case, basically post-surgical, but the surgery wasn't that complex. The surgery was just going in, fixing a fracture, plating it, putting in plate screws, and then that's it. The problem was post-surgery, because that person had both high blood pressure, and he was diabetic.
Wow.
Yes, and they were older, so they were in their 50s.
Yeah.
The trifecta.
The trifecta problem.
Yes. It took 3 months of rehabilitation, and I only got 50% of what I'm supposed to get in range of motion, strength, and ability to go back to life. The person is still complaining a lot. Still, the patient is still complaining. Still, I can't do this. I still feel pain. He says, I still can't close fully. I still can't really rely on my hand 100%. I still feel it weird. And I'm like, yes, that's unfortunate. It's going to be extended another 3 months. So we did. We extended it to about 6 months. And barely by then, at 6 months of rehab, we barely were able to get to about 65% of our original status compared to from before the surgery.
Like due to this multiple factors.
Yes,
that's
and
the maximum that you can really achieve.
Yeah, and then I had to be real with the patient, of course, and then I had to sit down now at this time and talk with the patient and tell him, like, listen, this is it. Nothing is gonna become easy, and you're not gonna get any better than this. It might get slightly better, only a slight, like 1 to 2 degrees, but in reality, forget about 90% or even 99% recovery. That's not gonna happen, and usually affects them psychologically and mentally. They become depressed immediately,
But that's admirable on your end, because you want your doctor to be harsh, true with you.
Yes, you want them to be honest.
Yeah.
You want your doctor to be, or your therapist to be honest with you.
Yeah.
If your therapist is lying to you and is just playing you along and saying
false promises.
Yes,
Because we see
giving
that
you false
sometimes.
promises, false hope that, listen, you'll go back to 100% without.
You'll be like a horse, huh?
Yes. While that's sort of okay for the 1 or 2 weeks, the beginning period, But after that, it becomes not only unethical, but it starts showing
Yeah.
in the patient. They will actually become worse later on due to the fact that they become psychologically and mentally so affected by this.
Yeah.
And they will say it that my therapist said I will be okay. How is this not happening? How am I not okay?
Yeah.
Not getting any better.
That doctor said that I should be okay. And they go, like, they
Blame
start
him.
getting opinions, and then they suddenly find out that, no, listen, that person was playing you. And that's when they start having trust issues with
Other doctors.
The other doctors.
physicians.
Yeah.
So it's like comfort me with the truth, but never ever makes me comfortable with a lie.
yeah.
Yeah.
And in that term, like, was there some cases where you had to collaborate with other specialty?
Oh yeah. For example, burns. I had a patient who had a
Severe.
severe burn, yes, on their hands from elbow up, and they sent them to me. They sent her to me in the beginning, become, as being a hand specialist and all, but I looked at her and I said, I can only help you minimally. What you need is a person who's not only specialized in burns, but you need a normal physical therapist to help you with your physical conditioning. Exactly. And that's when she said, okay, sure, absolutely, I'm all for it. And I transferred her to one of my friends in Baptain Center, and she was taken care of there.
And speaking of patients, for someone that walks into your clinic,
Yes.
how do you determine whether they need rehab, they need treatment, they need surgery, they need physical exercises? Like, what are
So
the
it's-
factors?
Well, it depends a lot. So let's say someone does come in now. I need to take their history. I record down their medical history. I start looking while they're talking about their medical history. I'm examining their mental state and their emotional state as well as they're explaining their medical history and they're explaining their injury. If a person is severely affected,
Yes.
severely depressed, they don't know what to do, and let's say, for example, they just came in to me. They didn't go to anybody else yet. They just came in to me, and I look at the variables. I look at what I can do for that person.
Yeah.
Is their injury so complicated that we cannot do therapy, or is it so easy that we can just clear it with therapy? So those are factors that I examine and look at. And then surgery is always in conjunction with my surgeon. There's a surgeon that I actually deal with here in Kuwait. We're in close contact between me and him. And whenever someone, let's say, is unsure if he needs surgery or not, he usually sends him to me to examine. Probably after 1 or 2 weeks of being in my care, it's and as I'm talking with this patient,
Yes.
there's a lot of back and forth to determine whether or not the person needs surgery or not. There's a lot of back and forth. So we always start with therapy, medicine.
Yeah.
Therapy, medicine. We always tend to start with that.
Two combination.
Yes. Sometimes just therapy, sometimes just medicine. It depends on the surgeon and the case of the patient. But surgery itself, we do not decide unless even the surgeon himself says that. Like, we don't decide on surgery unless we've known that we've used all of our options and have exhausted all of our options for treatment, and nothing worked. So now we can
It's
actually,
like a plan B.
Yes.
The last option.
it's the last option.
And I can imagine, like, if there's like a surgery that I want to do, or
Yes.
the doctor's telling me that,
Yes.
my emotions will be kind of like a roller coaster between stressed, nervous.
Right,
So what kind of
right.
maybe like an approach that you do with the client or like the patient to help him calm down and feel emotionally stable?
I'll give them actually a therapeutic session and prove to them that during the therapy session, they will not be able to benefit from therapy no matter what. Even if we continue this therapy for 6 months, nothing's going to improve.
Yeah.
And that puts them at ease. They look at their hand and they say, okay, so we did this therapy and really, yes, it didn't help. The pain is still there, or the inflammation is still there, and yada yada yada. And if I leave it just like this, it's gonna be bothering me for my entire life. If I just go with therapy, it's not gonna help. Dr. Ali is telling me, go back to the surgeon, do the surgery. It's gonna help you. They start feeling more comfortable and more confident.
They be more convinced.
Yes, and more convinced, correct, to do it. Yes.
I want to go on a lighter note and ask you something, because it pertains to personal habits.
Yeah.
Because my mom is also a doctor, and I know a lot of doctors have maybe rituals before going to their surgeries.
Yes.
It's like I know some doctors who like to wash their hands a number of times.
Yes.
They like to wear their gloves,
Specific way.
specific way.
Yes.
I'm asking, what are your personal habits?
So in the States, I didn't get a chance to form those habits, let's say, per se. But before we begin therapy, I always I have a signature move that I use on the patient, and the patient starts. It's a little bit humorous.
Yeah.
It's a little bit funny, but at the same time, it does provide relief
Okay.
and comfort
For
to
you or
for the patient.
For the patient.
Yes. So and that's usually my way of
Absorbing
yes,
the nervousness.
yes, all of that, and it's a signature move where I shake both of my left hand in a specific way that gives that feeling to that patient. It's both comfortable and relaxing, as well as a bit funny and humorous.
Yeah.
That's interesting. And if you could go back to the first day in the field,
Yes.
what one advice you would give to yourself?
Ooh.
Because I know there are a lot of students who would like to take this
Yes.
same career, same path, and they
Yes.
are really getting like inspired by, mashallah, your milestones and what you have achieved.
I would probably tell my younger self, try to pass the board exams as quickly as possible.
Board exam.
Yes. Try to take the board exams as quickly as possible, and as soon as possible, actually, before you leave the United States. Take those board exams and then go back to Kuwait.
It's like a time window opportunity.
Yeah, it's not. Yeah, it's not just that, because now, as I'm older,
Okay.
and they keep asking me like, why didn't you take the board exams way on earlier? And I'm like, yeah, it's in Kuwait, we didn't need to, and yada yada yada. It becomes hard to rationale for it. Give a rationale for it. Why did I wait so long to take those board exams? So next time, just do them.
Yeah,
Quickly.
I think that's an important message to end the interview on, is that don't waste time, especially in a field that's so competitive with so many people trying to get the same position as you are.
Yeah.
It's always better to get ahead of the curve.
Yes, get your credentials as quickly as possible if you can. Yes,
Definitely.
actually.
And if you are studying abroad in the United States, in UK, whatever country, there are some credentials they're not going to find here. So take the opportunity to maximize this opportunity.
Yes.
Because there's a time window.
Yes.
Thank you so much, Dr. Ali Shaban.
Most welcome.
It was
Thank
really
you.
an amazing conversation.
Thank you for
filled
having
with
me. Really.
inspiration, with some delightful moments as well, actually.
Thank you.
Thank you so much.
Right. Most welcome. Thank you so much for
Well,
having
thank
me.
you for being here, and thank you for the audience for joining us. And we're going to take a quick break, and we'll come right back. And unfortunately, all good things must come to an end. That was all of the time we've had on The Untold with Dr. Ali Sarraf. It was very educational, right?
Very insightful, very valuable information that he shared, and to show like the different expertise that he really has. It was really amazing to find all these cases how he deal with them, and what really need for people to practice sport.
Yeah.
So they can prevent this in the future.
Yeah, and I also admire Dr. Ali because, off camera, he was giving all kind of advices for us. He was inspecting all of the staff members of the show, basically giving them free medical advice. He's very approachable, he's very insightful, he's very knowledgeable, and it was so entertaining talking to him.
Such a great personality that make every Kuwaiti really proud, and every Arab actually.
Yeah.
And that he been recognized in the United States as someone who has the specialty. When he mentioned that, the doctor told him like, you are really the best in the stuff, and he just joined.
Yeah.
That show like how we are lucky as Kuwaiti to have him in this show.
Yeah, and I also want to tell everyone who knows him and who's going to visit him, ask him about his accents.
Yeah.
Because that was one of the hidden talents we've known about
That's a
him.
must.
Yeah, he knows so many American accents. It was very delightful talking to him.
I think we should do like another show called like Kuwaiti Got Talent.
Kuwaiti Got Talent.
He's gonna be the first guest. I think he's gonna be the winner,
Yeah,
definitely.
but until then, unfortunately, we have to wrap things up here. That was all of the time we've had on the Untold, and we're gonna watch you or see you next time.
Definitely. Play sport safely, and if you have any injury, you know who to consult. Until next time, stay safe. See you later.